Our bite-sized web is going to start right now, and I want to introduce Barb Kozuh, who will be talking about some of the great projects that Delta Dental is funding and how advocates and organizations can apply for funding to support access to care and oral health equity initiatives. So welcome, Barb. Nice to have you. Take it
Thanks.
away.
Thanks. Now, will the slideshow come up that I sent in?
Bobby, you're able to share your screen and yourself. We can do it for you though if you need to.
Hang on, share my screen. Guys, oh, there it is. See, one sec, I'm almost there.
No worries.
I want to put it in presenting mode. How do I do that? Oh, guys. I don't do this enough with a group, you know? Oh, wait.
Hey, Barb, I'm happy to share.
No, there we go. There we go. There we go. All right. Got it. Got it. Share.
Awesome. Let's do it.
Okay. So you can see that, right?
You're good.
Great. Okay. Wanted to primarily highlight the medical dental integration programs because those are a big priority for us moving forward. And there's 3 ways that we distribute money this way: through grants, which is an annual grant cycle, starts in August, September, ends in October. Grants go out January 1. Sponsorships of maybe an oral health event or screening varnish event, something like that, or projects, which are our bigger, where we're able to make more. We focus on kind of systemic change, making a system-wide change. In those projects, we highly emphasize medical dental integration and system change and move with bigger organizations. So one of those bigger programs that we're doing is with Phoenix Children's Hospital, funded an oral health educator position. We're currently looking to sunset that position after fully funding it for 4 or 5 years. They hired an RDH to help train the providers, nursing staff, and clinical workers on oral health and patient outcomes, work with the providers to improve those side effects, the mouth sores from chemo patients, and help the nursing staff train or help the nursing staff work on oral health with their patients, especially those who are there for long term. So medical dental integration and a system change. This is a new one, Banner University Medical Center. It's called the HOPE program. They hired a nurse navigator and an RDH to implement twice-a-day oral health protocols, basically brushing patients' teeth twice a day to help lower their risk of hospital-acquired pneumonia and improve patient outcomes. And what was so exciting about this is within 9 months, they were the system, the chiefs in charge of the whole entire system were thrilled with the results in 9 months and moved it to 28 Banner hospitals in 6 states. So that was a huge win for us. And for Banner patients too. We're looking to get some research results on that. So hoping to share that in the next year or two. And then this is another newish one. Banner started, actually, they applied for a grant and wanted to do this program. And I'm like, you can't do this program for $30,000 because that's the max grant amount. And so we worked with them over about a year and a half to get a program that we worked into a project. So that's something that was a grant application and an idea that we moved over to be much more impactful system change throughout that whole entire hospital system. University of Arizona, the College of Medicine. So they're a teaching hospital, or no, they're a medical school, and worked with them to integrate oral health curriculum into their medical curriculum, and worked with SIPCO, who I think Eve is here or was here, but in the call. Worked with Eve to get the curriculum, worked with U of A to create the possibility to have this happen. If you know, working with education, like your curriculum, changing curriculum is extremely difficult. So the fact that they were really eager and willing to work with us on this was exciting. So starting here in July, the first cohort's going to start on the first year of the changed curriculum. And we hope by 2030 that about 900,000 patients should be seen by the first 3 cohorts of graduating providers. So again, system change and integration. And this was a nice one because this was a grant program, not an outside program project. Chiricahua Community Health Center sent in a grant application that said, our population is really, really low on their vaccines, and our dental software we can see their medical records. So they talk, medical and dental talk. So we would like to, they call it scrubbing. They scrub the records for the patients coming in the next day. And for any patients, adults or children who need vaccines. And when they come in for their dental appointment, they say, hey, we see you're behind in XYZ vaccine. Would you like to have it while you're in the dental chair? And that is improving the access to both, to primarily medical. So it's kind of a flip-flop of how we have been working in the past, which makes this really exciting. And they have a 55.4% acceptance rate. And so they're really helping increase in their 3 dental clinics, or the vaccination rate. Wait, did I say that right? Oh, 44.9, not 54, 44.9 acceptance rate. So they're hoping that by the end of this year to get that up to 50%. So that's been very successful. They just won a state award by TAPI for their vaccinations program, for this program. Community health center programs outside of the Chiricahua program I just mentioned. So El Rio, Adelante, North Country, Dignity's not a CHC, but they're a small clinic. Those are typically just these 4 are just grant programs that we run, screening and varnish, embedded into medical. So kids come in for their medical visit and they get 5 minutes with either a student or a hygienist that gives them oral health education, gives them a smile bag that we provide, and does quick screening and varnish and referral if they need it. So it's a very important way of reaching them with their parents there and showing them the importance of it. The other thing it does is it's showing the parents that this must be important. It's happening while I'm in a medical visit. So it's kind of embedding the importance of dental to them. So these are kind of our priorities right now. But I encourage any of you to reach out to me if you have any ideas. We love innovative ideas. We love things that help you in your specific community. And we're really happy to work with you.